business is we have a hearing, discussion on, at 6:30 for Neil Jackson for a septic repair. Now, he is currently not here. Maybe it's weather related.
No, Neil had a conflict tonight. He is in Munson. He had 2 other prior engagements. So I volunteered to come forward to explain what he's doing. This property is at 41 Dressel Ave. It is on the verge of having been condemned because the system was in failure. The first time we looked at this was last year, but unfortunately the potential buyer fell through, so it fell back onto the loan company that owns the property. They have finally gotten to getting it done correctly. So Neil and John Prensel did the perk tests and the deep holes. They discovered a very high groundwater elevation, which requires a variance from Title V of at least 1 foot. He believes he's going to put in a mound system with a pump chamber, and the 1 foot will guarantee the correct distance between high groundwater and the bottom of the soil absorption system. I have approved it. I reviewed his plans and approved it, subject to his turning in a revised plan because he's missing buoyancy calculations for the septic tank and the pump chamber, which was an oversight. I discussed it with him, and he's going to revise his plan to bring in heavy tanks and pump chambers that will not float. So he's perfectly on top of this, but because of the timing, we wanted to get this in front of you this month so this project can get done and we can get this back in operation. So we're asking, or I'm asking on behalf of Neil for the local upgrade approval and the 1 foot variance on his distance from high groundwater.
Okay, for those of you that don't have an agenda, which is probably most of you, we are talking about 41 Dressel Ave. And we have had an overflow problem
Correct.
with the system for months now. So this is for the environment. This is a win-win situation. Now, does anybody on the board have any questions or comments?
Well, we've discussed this before, like I guess a year ago. So now everything will be all right, assuming he gives an updated plan.
Yes. Yeah, it was really just an oversight that he didn't put in the heavy tanks. When you put in a tank, septic tank, and a pump chamber, and the groundwater, high groundwater is right near the surface. Title V requires that you make them very heavy so they won't float when they're empty, because they're essentially, could be a boat. But once you put water and septic in them, they won't float. But there is a risk if the tanks are pumped and there's nothing in the tank and it's a high groundwater season, that tank could move. So you have to design them properly. And it's not a big deal when you know what you're doing, but sometimes there is an oversight, so we're going to fix it. But the real issue is allowing the distance from the high groundwater elevation to the bottom of the soil absorption system. He needs the 1 foot variance to get the proper distance.
Yep.
Now, do we have comments from the Board of Health, Mary? I mean, from the Conservation Office?
Yes, they're in the,
And they had no issues?
no, it's not within their jurisdiction as long as it's done according to plan.
Okay. And is any further discussion? Would anyone like to make a motion?
I would love to. By the way, this is the exciting stuff we usually deal with, septic systems. I move that we approve the application at 41 Dressel Avenue, subject to the acceptance by our staff of the revised plan.
I'll
Is there a
second that.
second? Okay. Well, we'll have a vote now. Pauline?
I improve.
Ken?
Yes?
Yes.
Jim?
Yes?
Yeah. And I vote yes, so the motion passes unanimously.
Thank you.
Thank you.
Thank you, Roger.
Any other discussion for our regular meeting?
You can't open the
We
hearing.
can't open till 6:45,
yeah.
so we might as well do some business here, regular business. And we have warrants, bills.
$278.87.
Well, they gotta be paid.
The select board numbers are usually like 2 million.
Well, we're not on that. And we keep our costs down, we're very frugal in this department. Oh, came from the operating table?
Did an open heart today.
Wow. We're safe tonight. We're waiting till 6:45 to open up the public hearing. And everybody here, what's all the pit for, if you don't mind me asking?
It's for Helping Hands Club. It's an organization at the high school.
Oh, okay, that's good. And if the room's a little stifling, that's, this meeting room usually is, we can't open a window with this weather.
You also have, in your agenda packet, you should have a printout from our public health nurse
Yep.
for, the last month
Infectious.
for cases in Maven.
Oh, yeah, I thought there were,
You wanna look
I
at
wrote
that?
back to her, I thought there was a typo on there, but.
Oh.
They were the number there
You
was.
like to read, you wanna read,
Okay,
Jeremy?
sure. So it was reporting a total of 8 COVID-19 cases in the last week in Belchertown. And these are only the ones reported, and since most people who get COVID, they go to their doctor, the doctor says, yeah, you have COVID, they go home, and that's never reported, it's only the ones that, so these numbers, which we've been getting now every month for the past, 4 years, really are just a fraction of the projection.
Underreported, so there.
There was 1 case of flu, and a total of 6 cases of other diseases, norovirus 2, Lyme disease 3, and chickenpox 1.
So the COVID is only hospitalizations?
It's only those that are reported.
Well,
People that went to their doctor and had an actual test, it gets recorded.
As opposed to people who test themselves at home.
Yeah, so that number is not accurate. There's way more.
It's probably
It's a
off by
very
a factor
underreported
of
number.
10 or something.
We'll never know.
No one will ever know, that's right.
where's Kirsten's report at?
Pardon?
Where's Kirsten's report?
It should be at the end.
We got it,
The bottom
oh,
of
okay, we got it in an email
bottom of
a few hours ago, I think.
From what?
Bottom.
the last page of your agenda.
I didn't understand what she asked for.
Oh, she wanted a copy of the report.
I want to read what Kirsten's report was.
Oh, that was, I just read
You
the
read
essence.
it, but I wanted to
Here,
see it.
here you go.
Yeah, COVID's still pretty prevalent. I saw a case on the weekend, a kid with a temp of 104. Yeah, it's still with us, for sure.
One of your kids.
Yeah.
Oh, really?
So,
Get your COVID shot, get
we had a
your
case
flu
of the-
shot.
We had a case of the flu today also. Influenza's starting up, and RSV is very common.
I'll see, that was on there.
And get your RSV shot. I have all 3. We should have dragged out the discussion on the septic system.
Try to-
Keep everybody's
try to pay
attention.
attention.
Well, in a few minutes, I'll open the hearing with the reading the guidelines. That'll,
Okay.
that'll kill 3 minutes. So what is Helping Hands?
Educate us.
Yeah.
A student group at the high school for students who want to focus on substance prevention and activities to help people in the community with their mental health and education and community service.
Well, that's wonderful.
I
Now,
can't, I-
before I open the hearing, I'm gonna take the liberty of reading the rules prior to opening the hearing.
You'll have to read them again, probably.
Really?
You'll have to read them again.
she's a strict taskmaster. I count at least 10 of you wearing the pink shirts.
There's more
tonight.
people in the hall. Can everybody get in, or?
There's even a seat up here, if you're willing to run the risk of sitting in the front.
I thought we were gonna be in the auditorium last time.
Well, we don't have 50 here.
This one. We do have a sign-in sheet. Where is that by any chance? I'll just bring that front.
We've got a lot of people online.
Okay, if anybody did not sign in, we do have a sign-in sheet. Was asking for name and address, please. Thank you.
For those of you who just came in, we're waiting till quarters up to open it there.
2 minutes.
Oh, you got 1 minute? 1 minute? 1.5.
Two minutes for the settling.
Do we?
Yeah, it's probably a clock on the computer too.
Well, I think it's close enough. I would like to make a motion that we open the public hearing for the Board of Health to discuss the current bylaw, the regulations on tobacco products.
I second it.
All in favor?
Nope, roll call.
No.
For a
All
public
in
hearing.
favor?
No.
I'm going to.
Oh, sorry.
You're gonna do this the whole meeting?
Yes.
Well done. Okay, all in favor now. Colleen?
Aye.
Ken?
Aye.
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 Okay, myself, aye. So it is unanimous now to open the Board of Health public meeting. Good evening, everyone. The Board of Health is holding a public hearing tonight on updates to their current regulations restricting the sale of tobacco products. The main updates to the current regulations include adding language pertaining to nicotine-free generation, which would prohibit anyone born on or after July 1st.
January 1st, sorry.
It says January 1st, I said July. January 1st, 2004, from purchasing nicotine products in an effort to prevent youth nicotine addiction and regulating the sale of oral nicotine pouches. Per Mass General Law, Chapter 111, Section 31, local boards of health have the authority to make reasonable health regulations in order to protect the public health by any rational means and are only required to hold a public hearing for the implementation of proposed regulations that are more stringent than Title V, the Mass Code for On-Site Septic Systems. Therefore, as a courtesy to our tobacco retailers and residents, and to maintain transparency within our board, we are holding a public hearing tonight on proposed updates to the board's current tobacco sales control regulations. As the Board of Health Chair, I would like to set the ground rules for tonight's meeting. Everybody can hear me, right? Okay. People who are acknowledged to speak will be given a time limit of 3 minutes. Those who have spoken will only be allowed to speak once. When acknowledged to speak, please state your name, organization, or establishment you represent, and address. Belchertown tobacco retailers and residents in attendance at this hearing in person will be acknowledged first to speak. Then any tobacco retailers or residents who are on the go-to meeting will be acknowledged to speak. After Belchertown tobacco retailers and residents have had an opportunity to speak, those in attendance will be acknowledged, and then if time allows, anyone else on the go-to meeting will be acknowledged to speak. The Board of Health members will not be answering questions at this hearing or engaging in discussions. They are holding this hearing to hear from those, I would say we are holding this hearing, to hear from those in attendance their support or opposition to the proposed updated regulations. When an individual is called upon to speak, all others in attendance must remain respectful of the speaker's comments. No jeering, heckling, applauding will be allowed. Please remain respectful and considerate of others, and the board reserves the right to close the public hearing at any time if order cannot be maintained. I'm sure that will not happen. So after reading all of this, I'd like to open the meeting for discussion, and Andrea, would you like to say something?
Well, I'll be keeping time for 3 minutes, so I'll let you know when 3 minutes is up. If you would like to address the board, if you're a Belchertown resident or a business owner and you would like to address the board in person here, we just ask that you come up to the board so that people on the go-to meeting can hear you, because if you speak and you're in the back, they won't be able to hear the comments that you have to make. So is there anybody that would like to speak first? Gail?
I'll do it and get it done. What's the best place to be?
Just right in front.
standing here?
Yep.
Okay, great.
Thank you, Gail.
Apologies to folks who are looking at my back or on CTV.
Just state your name and your address.
I'm Gail Grammarosa, 39 North Main Street here in Belchertown. Many of you know me as a retired public health practitioner, a health educator for over 40 years, and I'm also someone who personally experienced nicotine addiction as a teenager and a young adult. My personal professional opinion is that these proposed regulations will have a significant positive impact on public health and can prevent future generations of teens, I'm really glad to see so many young people here, from being saddled with nicotine addiction. This approach is new and innovative, this whole idea of looking at it in a new way, but all the scientific backing and the health-related evidence that you need to support this regulation is right in your statement of purpose. It's all there. I know where you're sitting. I served on the Belchertown Board of Health for 18 years. It's never easy to go out on a visible limb to protect public health and control disease. But you swore an oath to do exactly that. You are an elected official in this role. That's your job. I applaud many of the towns in eastern Massachusetts that have gone ahead and taken this approach. I really appreciate towns like Brookline that often paved the way. But I also feel like it's time for western Massachusetts to step up. And Belchertown has the opportunity to be a leader in this. We owe it to our youth, their younger siblings, and everyone coming after them. I also encourage you, do not fall for the argument that this is gonna destroy business. Same playbook that was used when we were prohibiting smoking in public places, in restaurants, in bars, when we were raising the taxes, increasing the age, banning the flavored products. All of the public policies that have been proposed and been shown to be effective were first often opposed because it could have an impact on business. Don't fall for that. There are lots of creative businesses in town. The of-age adults will still be able to purchase these products, and I believe these regulations give business owners plenty of time to comply. Lastly, I want to speak from the perspective of someone who knows what it feels like to be dependent on tobacco and nicotine. I was in that situation for almost 15 years. Like lots of people, I started young. I know how hard it is to stop. Nicotine and tobacco use is a local, national, and worldwide public health scourge. And it's often supported by deceitful marketing practices to young people, just like the folks here in the audience. The goal is to get addiction started early and have a lifelong customer. Local boards of health, I encourage you to be bold and brave, and when you're facing a serious public health issue. Am I almost done? The good news is you have the authority and the expectation to do this. You have the power to do it. I want you to do it so you can look these folks in the eye and say you did what your duty was. Thank you very much.
Thank you.
Thank you.
Now, is there anyone else who would like to speak?
Okay, if you could approach the board and just state your name and your address, please.
Hi, my name is Martha DeRoche. I live at 16 Magnolia Lane. I've lived in Belchertown for 35 or more years, and I'm also a high school teacher in another district. So I just wanted to say thank you to all of you for doing something that is that involves a difficult decision, and I hope that you're thinking about the youth in our town, the youth in the town I teach in, and really across the state. I hope that we can join other towns in looking out for the health and well-being of youth. So thank you.
Thank you, Martha. Now, I think, Ms. Dan Bodette, didn't you have your hand up?
Yeah, I can speak from here. I think you can hear me. I'm going to speak against this for two reasons. One is I'm hearing that it's going to have no effect on business, but I haven't seen or heard any data to that effect. Have you done any studies? Do you have any information as to what the impact on our local business is going to be? I haven't heard it. You know, you're just taking a shot in the dark here and saying, well, it's not going to have any effect, and you're going to go ahead and do it anyway. We're struggling to try to bring business into town to increase our business taxation so we can lower the tax burden on residential people in town. And here we are taking actions that might have a negative effect on business taxation in town. This is going to go to just the people that are doing business here are going to go somewhere else. The second reason I think that you should not be considering this is it's in Boston now. They've already filed legislation to try to make this a statewide regulation. So this battle is going to be fought on a different plane. And I think that's where it belongs. For the whole state or for none of the state, not this patchwork of we're going to do a town here and a town there, and pick the winners and losers. And I think that's what you're doing, is you're picking winners and losers, and I don't think it's fair to the business people in this town. Thank you.
Thanks, Dan.
Thanks, Dan.
Would anyone else like to speak to this?
We would.
Okay, great. Thank you.
Come up here.
So my name's Aline Mata. I am the advisor for the Helping Hand Student Group at the high school. And the group would like to speak and share their thoughts on the proposal, approving the proposal and supporting the proposal. So I'm gonna let them go ahead and do that. First, I'll have them all state their name.
I'm Mira Berryhill. Aubrey Harrington.
I'm Hayden Brissett.
I'm Raquel Pagoda. I'm Chloe LaRoche.
I'm Kaden Braddock.
Gianna Zenon.
I'm Claire Corbin.
I'm Kylie Fitzgerald.
I'm Colin Mullen.
I'm Logan Moses.
And I'm Paige Dias.
And together we are representatives of the Belchertown High School Helping Hands Student Group, which speaks up for those who are affected by nicotine products in our school and in our community. We refuse to be affected by nicotine products any longer, and we hope to stop the harm being done to our youth and pass the Nicotine-Free Generation Initiative. The usage of nicotine allows for dangerous addictions that consume many in our population. The rise in nicotine usage has greatly impacted our youth, and we hope you will listen to the proposal and hear our voices.
As high school students, we have seen the negative impact of nicotine products on our community firsthand. Vapes and other harmful products are found in our school bathroom, after-school activities, and are not only detrimental to our peers' health, but have affected even those who do not participate. For example, vaping nicotine in school bathrooms limits availability, cutting back on our class time, and creating extra work for teaching staff, who now have to monitor all school bathrooms for the majority of the school day. Additionally, secondhand smoke and vapor from e-cigarettes can affect even those who have never used a nicotine product.
Even though 88% of Belchertown's high schoolers choose to stay away from nicotine products, the extensive measures our school has had to take to manage nicotine use in school disrupts our education and perpetuates the narrative that nicotine usage is typical for teenagers. By passing the Nicotine-Free Generation Initiative, we can discourage nicotine usage and protect younger generations from starting these harmful habits. In fact, 90% of adult smokers in the United States began smoking by the age of 18. Each year, over 9,000 people in Massachusetts die from using nicotine products, accounting for 1 in 5 deaths in the U.S. overall. While 51% of teenagers start vaping nicotine with the intent to help with their anxiety, studies show that vaping nicotine can significantly worsen anxiety and depression symptoms.
The phasing out method used by the Nicotine-Free Generation Initiative not only prevents severe economic impact to small businesses in Belchertown, but will increase its impact over time. Currently, about 12% of teenagers in Belchertown reported using nicotine, according to the 2023 Preventative Needs Assessment Survey, ultimately making it a threat to the safety and health of our student body. By slowly decreasing the amount of the population that can buy nicotine products, the new nicotine-free generation policy will eliminate ease of access to the youth at our local businesses and give them ample time to modify their model and find healthier alternatives.
In conclusion, we hope you consider the voices of our youth and choose to advocate for our health and well-being. Passing this initiative is an integral part of protecting our youth and changing the way nicotine is used and perceived for generations to come. Thank you for your time and consideration.
Thank you.
Thank you.
Thank you all.
Now, before I go to the the meeting residents,
Maybe somebody's here. Sorry.
I want to know if anyone else in the audience would like an opportunity to address the board. Okay, I take that as a no. All right, well, thank you. We'll now go to the people on the meeting board. Let's see, who do we have?
We have some hands up already. Please just raise your hand on the go-to meeting if you are a Belchertown resident or Belchertown business, so we can address you first.
I guess Stephen has his hand up.
Middle,
Center, bottom center.
middle.
Yes, Stephen
Heller.
Heller. Stephen, would you like to speak to us, please? Can you hear us?
Yes.
Wonderful.
My name is Stephen Helfer. I represent Peter Citizens for Smokers' Rights.
I'm sorry, Stephen, you're not a Belchertown resident. We're only calling on Belchertown residents or businesses at the moment.
Thank you.
On the go-to. So please raise your hand if you'd like to speak on the go-to if you're a Belchertown resident or business owner. There's one hand.
Where? Your head might be blocking.
I don't see this.
No, it's just Mr. Heller.
So apparently there's no
So
Belchertown
there aren't
residents.
any.
No, okay, so far there's none. So then we'll go back to in person for anybody else that's not a Belchertown resident or business owner. If there's anybody else here that wants to address the board, you can do so at this time. Going once.
Don't see too many willing to speak.
Okay.
All right, then I'm gonna then now go back to Stephen. It's Helfer?
Yeah.
Okay, Stephen, thank you, and could you please address the group?
Yes, my name is Stephen Helfer, and I represent Cambridge Citizens for Smokers' Rights. We receive no funding from any source whatsoever. This September, the Centers for Disease Control reported that teen cigarette smoking is at its lowest on record. Teen vaping is at a 10-year low, and teen use of nicotine pouches, as described by the FDA, is at a low 2%. FDA Tobacco Product Director Brian King proclaimed the continued decline in e-cigarette use among youth is a monumental public health leak. Adult smoking, according to Gallup, is at an 80-year low, and the CDC confirms this by noting on its website that for every 3 persons in the U.S. who have ever smoked, 2 have quit. Evidently, nicotine and tobacco have not robbed the majority of smokers of their free will. When smoking rates are so low, burdening store owner with onerous new restrictions seems uncalled for. Many of these owners are immigrants of color who put in long hours and depend on small profit margins. This proposed ban does not apply to youth at all. It applies to adults 21 and older. So that would mean that within 5 to 10 years, for example, a 30-year-old combat veteran would be unable to buy a cigar, but 21-year-olds would be free to buy marijuana, alcohol, to vote, to serve in the military, etc. I think to most Americans, this would not make sense. This proposed ban abridges adult liberty and serves no critical public health need, and I ask you not to pass it. I'd like to add one more thing. In the last 50 years, the number of Americans who have smoked has precipitously declined. It's at an 80-year low at about 11%. And it's interesting because even though we were told medical costs would be reduced if people stopped smoking, in this 50-year period, they have gone up 400%. So again, I don't think this is a necessary ban. I think it infringes adult liberty and hurts local merchants. Thank you.
Thank you. Before we continue, I just want to read to the people online that we are asking for a 3-minute minimum.
Maximum.
Max, yeah.
Maximum.
He stuck to it.
3-minute maximum while you're addressing the board, and that would be muchly appreciated.
So I think if you kind of hover over the hand, it shows the people. Maybe we could go in that order, because it's tough to tell like who had their hand up first. Does it give you a list?
No.
Are you sure? I thought I saw like.
Heather Warner. Heather Warner's number 2.
Okay, so Heather, you're up. Yep.
Heather, yeah, we're asking you to speak now. Thank you.
Hi, thank you. My name is Heather Warner, and I am the Hampshire Franklin Tobacco Free Community Partnership Coordinator. I work at the Collaborative for Educational Services out of Northampton, and Belchertown is one of the towns in my service area. I've been to many of these public hearings throughout Hampshire and Franklin County in the last month or two, and it's incredible to see how many people are coming to these meetings from out of town who are representing industry. So I will be interested to see who's here today. But I'm writing in support of the Belchertown Board of Health's action to protect teens from nicotine dependence by reducing access to tobacco and nicotine products. Easy access to these products increases the likelihood that youth will start using and become dependent on nicotine. Some of the products that are coming out today, including nicotine pouches, have high levels of nicotine. We saw that with Juul as well, where they use also nicotine salts, which are synthetic nicotine, which actually absorb into the bloodstream faster. So in addition to being higher potency, they are also absorbed faster and are highly addictive. The tobacco industry understands that the developing teen brain is particularly susceptible to nicotine dependence, which is why they shamelessly market to youth with new products that evade the flavor regulations and taxing systems, making them more affordable and appealing to teens. And that's the case with ZID, which is under-regulated by the FDA and is also not approved as a cessation device. The proposed, I would just also say that as adults in our communities locally, we have both the ability and an obligation to make policies that keep pace with an industry business model that will always require a new generation of nicotine users. So in your proposed draft regulations that reduce youth access to nicotine, it does that in several ways. One is by restricting the nicotine pouches. Secondly, through the nicotine-free generation policies, and thirdly, by just closing some of the loopholes for illegal sales of flavored and unregulated products. One of the things that's happening is that retailers can hold flavored nicotine products on their premises if they are intending to distribute them online across state lines. And that's become sort of a place where people are getting around regulations and selling these out of, their back door and under the counter and things like this. And we've seen a lot of that through compliance activities in the last few months.
Your 3 minutes is up, Heather. I'm sorry.
Oh, okay. Thank you for your good work. I support you in passing these regulations. I think they're really important.
Thank you. We just want to make sure everybody has a chance to speak. So if you've So please unraise your hand after you've had it up so we don't get confused. Ed, do you know who's third? Okay, Anthony, you're up next.
Anthony?
Yep, we got him.
Sorry. Good evening. My name is Anthony Ishak. I am a pharmacist in the town of Brookline, and I was a co-petitioner for this novel health policy when we brought it up before Brookline's governing agency in town meeting for public health. I'm here to, of course, speak in support of this very simplistic but very effective public health policy to counteract tobacco industry's attempt to addict new users. Some of the things I just wanted to bring up for your consideration. The lower rates that have happened over the course of time are as a result of public health actions as this. If you recall 2019, the headlines in most newspapers were about the vaping epidemic happening among youth. That decreased with the passage of laws removing flavored products from many states and municipalities. So every time industry increases the rate, public health has to counteract it. This is a chance for public health to end this ping pong battle. It takes 8% for each attempt to quit, an 8% success rate, and an average of 5 to 6 attempts. So this isn't easy to give up. It's much more difficult than alcohol, and other substances. Youth who use this are exempt from applying to the police academy, from the fire academy, which I think is important considering Belchertown has the old firehouse museum. So many of the youth would not be eligible to join the police, the fire. If you're a tobacco user, or basic training for the military, which prevents you from becoming one of our honored veterans. There's been a decrease in cognition for vaping use underage on test scores when you're between 18 and 21 years. So this very quickly impacts and closes off their future when they use and get addicted. 25% of ZYN users are underage. So this is, again, a very important policy. It's a simple date for retailers. They no longer have to work backwards to figure out a date. Anyone born after 2004, when they're doing IDs, won't be able to buy. And in Brookline, no retailer or store has closed after nearly 4 years of this policy. Money gets spent elsewhere in the community. In Belchertown, I have a goal in my life to visit every town in Massachusetts because of the history. When I went to Belchertown, I went to a local business, Runsaka. They make handmade things there. The money would be redistributed within the community and spent on other things other than tobacco. So the money will stay in the community. I encourage you to vote in favor of this action. It will help slowly help businesses adjust while having a major landmark on decreasing tobacco use youth in your community and the costs associated with it, which on average is $1,100 per household in Massachusetts.
Thank you, Anthony. Your 3 minutes is up.
Thank you, Anthony.
Yeah. Who's next?
Who's
Emily
next?
Ouija.
Emily?
Hello, my name is Emily Ouija, and I live in Cambridge. I'm a private Massachusetts citizen, and I'm concerned about adult agency and liberty. I have no connection to any industry. Everyone who's spoken in favor of this ban tonight talks about nothing but youth and teenagers, and that's entirely irrelevant. I oppose this policy because it proposes restricting adults' freedom to choose for themselves. We allow adult consumers in Massachusetts to choose addictive substances and practices, such as alcohol, marijuana, and gambling. It's ridiculous to propose a complete ban on tobacco and nicotine and arbitrarily remove adult choice for these substances. Tobacco and teen vaping are declining, so Tobacco Control proposes to take a sledgehammer to adult choice and ban tobacco and nicotine in all forms without investing in adequate education. It makes no sense. I'd also like to add that Worcester and Peabody Boards of Health have rejected this unjust proposal recently. So I ask you to also reject this proposal and stand up against the stifling of free choice for adults. Thank you.
Thank you, Emily.
Thank you, Emily. Okay, Ed, who was next?
Kate Silva.
Kate, would you like to speak, please?
Yeah, just briefly, I'm Kate Silva, and I was a co-petitioner of the Brookline warrant article with Anthony Ishak. I just wanted to correct that Worcester Board of Health has not voted on this proposal at all. I just wanted to thank you guys for considering this and just make a couple of quick points about the retailers. Obviously, it's a painful process anytime you have to make a change in business. I think the reason, though, that the Brookline retailers law remained open is that they don't lose a single customer under this regulation. This regulation affects their ability to sell to people who they cannot yet sell to. This is the new pipeline. That's the only group that's affected by this regulation. Now, it's true that most people start using nicotine when they are minor, but they also get their nicotine through their social networks. So if you are gradually aging out the group you can sell nicotine to, then your teenagers don't have social network access because they know 21-year-olds, but they don't know 26-year-olds. So this is part of why we think it works. We also think that you avoid a black market with this system of a slow birth date regulation, because those who currently use the product the retailers can continue to sell to those people. So you don't have a new demand being created, and so you don't have a black market. In short, you know, I'm sure you've heard that Chelsea adopted it last night, and we're very excited about that, and we really look forward to Belchertown being the first jurisdiction out of the eastern part of the state for the nicotine-free generation. Thank you.
Thank you.
Thank you, Kay.
All right, now we've got two more hands. I think, what is Ginny?
Ginny is the next one.
Ginny, would you like to say a few words, please?
Yeah, thank you so much. My name is Ginny Chadwick, and I came to Massachusetts to do my PhD in social policy 3 years ago. And when I came here, I came from Columbia, Missouri. I started looking at Tobacco 21 policy when the 8th community had passed Tobacco 21, and I was the bill sponsor for the 31st Tobacco 21 policy to pass in the nation. And I want to say that, as you heard, Chelsea passed it last night, they were the 10th. Momentum is growing, and these movements that you do locally at the Board of Health level in Massachusetts will have ripple effects across the country. And so I just want to say thank you for considering this. What you're doing is so important, and it's not just for your community, it's for all of our youth, but it is for your community as well. So thank you.
Thanks, Jenny.
Thank you. Let's see, now we have Jonathan.
Emily Kirby would be next.
Okay.
She there?
Didn't she already speak?
Yeah.
This is another Emily.
I had lowered my hand, but I thought I was next.
Yeah, that's what I was about to say. Yeah, if you want to go before me, your hand was raised. I noticed you put it down quickly.
Thanks, guys. I wanted to thank the board, but I'm Jonathan Winnicott. I'm a general pediatrician. I'm speaking on behalf of my colleague at Boston Children's Hospital, Dr. Lester Hartman, and I'm at Mass General. What we wanted to say that we've seen over 100,000 pediatric visits. I want to thank the youth for coming out tonight, because after all, this proposal doesn't affect most of the adults here. It really affects the youth. And so when we look at this proposal and who it affects, the people who it affects are in favor of it. And that's, I think, where we need to focus, is on the youth. Absolutely true that as you age up, you won't be able to get your tobacco from those older people who have the ability to purchase anymore. So in that sense, this does gradually and protect the next generation. Nicotine itself is a harmful and dangerous compound. It's been compared to heroin and cocaine in its addictiveness. It creates depression, anxiety, worsens ADHD, and increases suicidal ideation. These are all from the Institute of Medicine and the NIH. It has a gateway drug effect for cocaine, opiates, alcohol, and potentiates the reward system for even other addictive substances. I'm keeping my remarks brief here. I want to say, as a general pediatrician, almost nothing that you could do would have a bigger impact than this regulation. Years from now, you look back that you did this, and it'll be the crowning achievement, really, of the tobacco control system and of the morbidity and mortality that you prevented in your community. Tobacco has caused the greatest health detriment of any consumer product in history, causing more annual deaths than AIDS, alcohol, car accidents, illegal drugs, murders, and suicides combined. Tobacco has caused more deaths each year in the United States than the number of U.S. soldiers who have died in all of World War II. And that's each year. There's almost nothing you could do as a Board of Public Health that would make a bigger difference than this. It's a logical proposal. It's a wise proposal, and I thank you for considering it. And again, thank you for coming out, because this really does affect you, and clearly you are in support of it. Thank you very much.
Thank you. Now we have Emily.
Oh, Emily.
She's got her hand
Hi
up.
everyone.
Emily.
Yeah. Hi everyone, my name is Emily Kirby. I am the Director of Prevention and Community Health for the town of Ware. I oversee Quabog Hills Substance Use Alliance, and I am here today to speak on behalf of the Substance Use Alliance in favor of this initiative. initiative. I agree with everyone that has talked before me, so I will refrain from speaking too long on the negative effects of nicotine. But yes, the QHSUA is in favor of this initiative, so thank you.
Okay, thank you, Emily. Now, is there anybody else who's got their hand up? Am I missing?
Peter?
Peter Brennan.
Peter.
Where is? Okay, I don't see.
Peter?
Peter, are you there?
I think he's coming back on.
Oh, Peter Brennan, he has arrived.
May I ask just one question?
Yes.
Emily Kirby is from where? What?
Quabog Hill Substance Use Alliance.
Okay, thank you.
Peter, are you available? Can you hear us?
He's muted if he's.
Give this a few minutes. Peter, are you still online?
Okay, he's unmuted.
Yes, I can hear you.
There you go.
Okay, now we can hear you. Thank you. You're up.
Can you hear me? Thank you.
Yes,
I'm,
yes.
A lot of storms in the area that I'm in, so I think our town might have lost power in and out. But Peter Brennan, Executive Director of the New England Convenience Store and Energy Marketers Association. We oppose both the nicotine-free generation and nicotine pouch restriction policies. I think that the advocates are being intellectually dishonest when they tell you that things like the flavor ban have been a success. Flavor ban has been an abject failure. The Tax Foundation just released a study the other day showing that we're now the 4th in the country in tobacco smuggling in Massachusetts. All it's done is enrich our neighbors in New Hampshire and Rhode Island. And they're also intellectually dishonest when they say this is about youth smoking. This is not about youth smoking. This is about adults. This is about adults' rights to use, purchase nicotine products like they do alcohol, like they do marijuana. And they can go gambling in a casino. They can gamble on their phones. It's an adult choice. It's something that everybody needs to make personally. And there's no reason to ban this. There won't be any public health benefits. This is going to create an illicit market that's going to be even more robust than it currently is. And guess what? If it goes to the illicit market, then there's no IDs to be checked. You don't know what's in the product. You don't know what you're getting. So I think that, their argument, the advocates, there have been many of them. They frequent every hearing. I've heard all the arguments. It doesn't add up. The facts aren't there. The fact is, if you want to reduce youth smoking rates, which we do, which everybody does, then keep putting money into cessation, keep putting money into education. Where does that money come from? From taxes on nicotine products that adults can legally buy. And if you're worried about kids and, flavor vapes in school, well, guess what? If you seize a couple of them, you'll probably find that they're ordered online, they're from China, nobody knows what's in them. And how are the kids getting them? Because the flavors are illegal in Massachusetts, so they just go somewhere else. I'll stop there. I'll take questions. We oppose these and nicotine pouch restrictions. Again, these are products that people use to get off of combustible cigarettes, which the health advocates will tell you is much worse for you than nicotine pouches. Why would we restrict those to adult-only facilities and take the money away from our retailers who provide essential services to the community, who sponsor teams, who are there when you need to go get milk, eggs, gas, whatever else? And this is really just a slap in the face to your retailers that provide a substantial tax base to the town. Thank you.
Okay, thank you.
Peter.
Thank
Okay,
you, Peter.
I mean, we're over the public hearing, so.
Time limit, well, it says 7:25 on.
Right, so it was, the agenda says
Well,
it's.
it's about 10:02, so
Yeah, and that was the last person on the go-to, so,
it's everybody.
everybody that's wanted to
I think everybody
speak
who wanted
has
to
spoken.
address this board has already spoken.
So thank you.
And are we all set here now with the people in attendance? Everybody who had a chance?
Yeah.
Okay, well then I guess the public hearing or part of this hearing is concluded.
Yep, so there should
We
be a
gotta move
motion
to
to
close
close
it.
the
And
public
now we
hearing.
need a motion to close from the board. Would anybody like to make a motion?
Motion to close.
Okay, is there a second?
Second.
Okay, we're gonna do a roll call vote. Okay, so Colleen,
Colleen Derochet, yay.
Ken,
Yay.
Yay.
Jim,
Yay.
yeah, and myself, yay. So that is unanimous, and the public hearing is now concluded. And thank you all for attending.
So now you're gonna open.
We are now gonna open our regularly scheduled meeting to discuss the tobacco regulations. Mr. Barry, you have something you'd like to
I'd
add?
just like to ask, are you voting on it tonight, or are you going to
If
Yes.
take some time?
we have it on the agenda tonight to vote. So if the board is comfortable
Yeah.
moving forward with that, they can do that.
Yep.
So there needs to be a motion to reopen the Board of Health meeting.
I'd like to, I thought I just did, but
I guess we closed the other one.
We closed the hearing and then.
and now I'm gonna make a motion and ask for a motion to reopen the Belchertown regular Board of Health meeting.
I second
Is there a motion?
Yes, so I make a motion to open the Board of Health meeting.
Is there a second?
Yes, second.
Okay, now we gotta have a vote. A little redundant, but, Colleen?
I vote yes.
So,
Proudly, yes.
Ken?
Yes.
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 Yes, okay, it is unanimous. We are now going into our regular Board of Health meeting, which has been reopened. So would anybody on the board like to speak?
Yes. I just to kind of structure this, there are basically three different things for us to consider tonight, and I'm going to, just to open it without discussing it now, but the three basic things are the nicotine-free generation, the oral nicotine pouches, and then some kind of administrative work on the technical stuff and the paperwork. So I'm going to move that the Belchertown Board of Health adopt the nicotine-free generation policy into our tobacco regulations by replacing the age of 21 with born on or after January 1st, 2004.
So you made that motion?
That's my motion.
That's your motion. Is there a second?
Second that motion.
Okay, is there any discussion on the motion?
So you're taking Ken up to a vote right away now, or?
Yep.
Well, you discuss it if
He
you want.
made a motion, and I asked if there was any discussion amongst the board.
Yeah, I would like to, I'd like to address the reasonable objections of some of the folks that were against this motion. And I think, Ken, you addressed it in an email. One, Mr. Baudette's mentioned impact on local business. You had some analysis where you talked about that this actual nicotine is a small part of the convenience store's business, especially since it would be a very small decrease in the amount of nicotine bought, because it's just one year per year of I'm not expressing it right, but there's just one every year the people that can buy it, the nicotine, get a year older. So it's a small decrease in those numbers. So in fact, your analysis, I forget where you get the numbers, shows that the impact on local business would not be significant at all, especially convenience stores. Is that right? That you brought that?
It's been
stated, yes.
Yes.
It's been shown in
Yeah.
other towns that have done this, that it hasn't affected, nobody's gone out of business
Yeah,
because of it.
impact.
I'd like to say something.
Mm-hmm.
I have concerns that because we are a municipality, that somebody can go next door to Granby or Ludlow and buy cigarettes. So I think in that respect, it's not going to be as effective as if the state would adopt the nicotine-free generation policy, and therefore would be much easier to enforce and less burdensome on the municipality, and it would create a more fair playing field for the small businesses. And in a perfect world, that is how I would like to see this myself personally come down.
In Brookline, when it was the first time to do it, that didn't happen. They didn't find that people went next door to buy it somewhere else.
I heard that. I'm not in Brookline, and I don't know if they keep track of where everybody goes all the time. Ken?
Yeah, I mean, you're absolutely right. This should be a statewide ban. And the history of this, with respect to changing the age from 18 to 21, was done town by town by town by city by town throughout the state. It took 175 different municipalities to approve this on an individual Board of Health basis before the state legislature got its act in order and voted to do it statewide. So if we vote yes tonight, we will be the 11th, and let's hope we don't have to go all the way to 175, which, by the way, is exactly half of the 351 municipalities in the state. This should be done, and obviously it's a lot better if it's done throughout all of the towns in Massachusetts. But this is a statement to the legislature, let's get on with it and do this.
It's a piece of the puzzle.
Piece of the puzzle, yes.
And
You're absolutely right.
I don't want to see anybody smoking. Nobody has suffered the consequences of cigarette smoking in their personal lives probably more than me. I personally am torn between this decision. Any other discussion? Did I interrupt you?
No, if someone else, there was a second issue that was brought up by, I believe, Mr. Brennan, who was pretty strong in his statement that efforts to outlaw flavored tobacco, flavored nicotine products has been an abject failure when we outlawed in Massachusetts. But that's in direct contradiction to Stephen Heffers, the Citizens for Smokers spokesperson, who quoted statistics, which I believe are correct, that there's been a dramatic decrease in the number of flavored nicotine users. So that would argue for these kind of bans. As several other speakers point out, that you make it more difficult to get, and there will be decreased use, even if they're getting it from friends, even if they're getting it from other towns. I think there's a cumulative effect that builds up. So I think those two speakers actually indirectly supported this kind of ban.
Right.
Yeah. If I got that right, if I heard them correctly.
Jim, do you have anything?
No, I was just gonna kind of reiterate what Ken was saying, that it's baby steps. Every town, we all got to work together as towns and cities and in the state to get this through the state legislature. So I think this is just a good step in the right direction.
Any more discussion?
I just wanted to also say that I was very impressed by the young people who came out.
Me too.
I wish, the general population, even some doctors, were as educated as you folks are, and as convincing. It's great to hear from you.
And your parents should be really proud of you.
Yeah.
There's hope for the future.
We'll see you at town meeting after you're 18.
So are we done with the discussion aspect? And we still have a motion on the table. Would you mind?
Yeah, okay. So, do you want to repeat it, Mary? The motion? It's only the one aspect so far, which is the tobacco-free generation. I can
adopt the nicotine
free generation.
The motion to adopt the nicotine-free generation policy into your current Board of Health regulations, which would replace the age of 21 with born on or after January 1st, 2004.
Okay, and the motion was seconded by Colleen. Right?
Yep.
Okay, well, we're gonna have a roll call vote. So, Colleen,
I probably vote in favor.
Ken,
Aye.
Aye.
Jim,
Aye.
and I'm going to abstain. So the motion passes for, what?
I'm going to make another motion.
I'm sure you are, but the motion passes 4 with 1 abstention. And now Mr. Elstein had his hand up and he's going to, you're gonna make another motion.
Move this along, yeah. At
Move
least have
this
something to talk about. I move that we regulate oral nicotine pouches by language stating that oral nicotine products can only be sold in adult-only retail tobacco stores. That's number 4 on your list.
A second.
There were other options that we had talked about.
Any discussion on this motion?
Nope.
Okay, well, I'll do a vote then.
Can I just say, the other options that were included, we do not want to discuss them at all. They've all been gone through. Number 2, 1, 2, 3, 4, 5.
They're alternatives to each other.
Mm-hmm.
So
So
my motion was to choose number 4, that it can only be sold in adult-only retail stores.
We don't have any adult-only retail stores in
That's correct.
Belchertown. Okay, so there's no discussion on this, correct? Let's do a roll call vote. Colleen?
Aye.
Ken?
Aye.
Jim?
Aye.
Dave?
Aye.
And I'll say aye. So it's unanimous.
Thank you. 5-0.
Who did the second?
Colleen. Ken motioned, Colleen seconded. And I guess that's
Nope.
Number
One
3.
more.
number 3.
Yep.
We have one more motion. Go ahead, Ken, if you'd like to make a motion, or do we want to discuss this first?
Discuss what?
Go ahead.
Well, I'm just going to move it. I mean, it's just to accept all the other updates presented in the draft regulation. It says that Andrew would read them off.
They're minor changes. The 2 biggest updates were incorporating nicotine-free generation into the regulation and different ways to regulate oral nicotine pouches. The other ones, there's just some minor updates with the statement of purpose to reflect updated information. There is a new definition for oral nicotine pouches included in the definitions piece. And then the other changes, minor updates actually, would be under the violations, because you're going to be including the oral nicotine pouches. It does shift some of the sections down a little bit. So it just changed one of the sections, which is on page 11, violations. It says, and section D of this regulation. And that's just to incorporate the shift. When you add another piece of the regulation, it shifts it's not like a code, but it's like an A, B, C, D. It just shifts things down a little bit. And then on the page 12, it just says, except for section D of this regulation, and section D of the regulation talks about the no tobacco sales to persons. It says born on or after January 1st, 2004. So it's just making reference to that. And then the last change would be on page 13 for, it's item number 7 under section T for violations. It says, a permit issued pursuant to this regulation may be suspended, revoked, or not renewed for any of the following reasons. A, violation of the permit holder of any provision of state or local laws and/or regulations. Or B, fraud, misrepresentation, false material statement, concealment, or suppression of facts by the permit holder in connection with an application for a permit or for renewal thereof. That was the only addition into the regulation. Otherwise, everything else is what your current regulation is.
So we need to vote on
Thank
that. I
you,
have another motion after
Andrea.
that, by the way.
All right, so would anybody like to make a motion?
Well, we moved that.
We moved that, and do we have a second?
Second.
Okay, and any discussion other than what Andrea just
Yeah, these are
reiterated
just
for
technical
us?
changes and renumbering and that
Minor.
kind of stuff.
Okay, so this, but you didn't, is there any discussion?
Nope.
Thank you for explaining that to me again. All right, so we'll do a roll call vote. I'm starting this way now, Dave, just to shake things up a bit.
Yeah. Aye.
Aye.
Aye. Okay.
Aye.
Ken,
And I say aye also, so the vote is unanimous.
I have one other thing on this, which isn't in our list. Traditionally, when we change regulations, we give people time to implement it. And I think in the case of the pouches, I think there's at least one vendor we have, I don't know. But I think we should probably give, we don't have to do anything on the nicotine-free generation. That could happen instantly tomorrow. But for the pouches, we would probably should give them 30 days to sell out or whatever.
Okay,
Something like that.
that's reasonable.
30,
Well, I don't know, I'm throwing that out, but we usually do that.
Yeah. we
when,
do.
without us stipulating, when would that go into effect? You could
Just
give us
looking
some
at my
guidance.
I don't know if we had
calendar.
anything
So
in
30
there.
days from today would just be, January 11th is on a Saturday, so if you wanted to pick,
Right, but if we just, do we have to pick a date, or would it go into effect?
it goes into effect immediately if you sign this without voting to give some sort of extension period to comply with the nicotine pouches, because otherwise, if this goes into effect immediately, then like the next day, pretty much tonight or the next day, they would have to, everybody that is selling nicotine pouches, the oral nicotine pouches, would have to remove them from their shelves.
I would like
So
to,
we should
At
give
least
them
30
some
days.
time.
I would like to go 90 days, but that's, I'm only one person on the board.
60 and cut the difference? Split the difference?
I'm sure that people are gonna go in there and buy them out, so they won't be on the shelf for very long.
Well, that's not our concern. I think, in my opinion, it would give the small businesses another couple of months to, just,
Well, if it's to sell what they have on the shelf, but not to buy more and put it on the shelf for 90 days or 6 days.
you can't be everywhere all the time. It's up to the board. I'm gonna make a motion that we give, like David said, a 60-day time limit before this goes into effect.
I'll second that.
Okay, we're gonna do a roll call vote. Dave?
Aye.
Ken? Jim?
Ken.
Aye.
Ken, yes.
Aye.
Aye.
See, if they turn the nameplates
Aye.
around, we get
Yeah,
it
it would
right.
be great for me, wouldn't it? Thank you. All right, so the motion passes unanimously.
And so that date, so 60 days.
Days would be, that motion would go into effect.
31 days in both December and January.
Yeah.
So February 9th.
Yeah, that's probably right. February 9th?
Yes, that sounds about right.
I had heard.
I'm going
that-
based on your
I had
math.
heard this is flying off their shelves, and they'll probably be sold out quickly, but
Okay.
whatever.
So February 9th.
Okay, well, thank you. Any further discussion regarding the tobacco regulations?
Nope.
Thank you, Leanne.
Thank you. Well, thank you
Conducting the
all
meeting.
for attending.
Thank you very much.
And if you have any questions or concerns, call the
Do we,
Board
are
of
we
Health.
ready to, are we ready
We're not-
to?
Oh, we gotta
Adjourn?
sign, we gotta sign
No,
first,
we're not
right?
ready to adjourn yet.
Oh, that was my question.
Have it in the meeting minutes. It's 90
We have
days.
some housekeeping issues.
Oh, we do?
Yeah. The chair does.
Okay.
I don't know,
I
maybe
know, how far can you shoot
holiday.
it? From like here to the end of the room?
Are you, by the way?
Not too bad.
Thank
Not bad.
you.
Nice Thanksgiving?
All
Yeah,
right, we
yeah.
have here.
Pretty low key. It was nice this year.
Didn't travel far?
Nope, stayed home. Everyone, couple folks came to us, so it was nice and relaxing.
Oh, I can't pass.
And we got all the leftovers, so that was nice.
I love that. I rescued a carcass and 2 drumsticks.
Yeah.
My son-in-law in Canton, he's the neatest guy I ever met. He's
Thank
the
you.
rubber gloves, carving the
Oh,
turkey.
jeez.
He was done. He's the carcass.
We need to, wait.
All right, we got a
We
few
got
more
adjourned.
housekeeping issues.
Yeah. Yeah.
Warrant, we did
We did
the
that. We
bills.
just gotta
Well done.
adjourn.
Well done.
And we're gonna adjourn, but I wanted to wish,
Excuse me, we still have a meeting here.
yeah, you can go outside and talk, guys. I mean, out in the hall, not out in the rain. We've got our warrant article as
Write it
signed,
on
and
here.
I'd just like to thank everybody for their participation tonight, and I also wanted to hope everybody has wonderful holidays and is healthy and
smoke-free.
Smoke-free.
Yeah.
All right, so I guess now we need to make a motion to adjourn. Would anybody other than
Don't do
Ken
it,
I'll
don't
make-
do it,
make
don't
a
do it.
motion?
I'll do
Don't
it.
do it.
I'll do it. I'll make
Yeah.
a motion to adjourn at 7:48.
Oh, does anybody want to second that?
Second.
All right, all in favor?
Aye.
Aye.
Happy New Year and happy Merry Holidays and, ooh, Christmas. I'm not allowed to say that word.
Yeah, sure
I
you
did
are.
anyway. Thank you.
Oh.
House is bursting at the seams.
Sign your name.
Yeah, ours
The
too.
Jewish